Gentlemen, let me ask you something simple before you finish your next cup of coffee. What if one of the most familiar things in your kitchen, something you've used for decades without a second thought, could quietly support circulation and comfort as your body ages, when it's used the right way and at the right time? I know how that sounds. Coffee and garlic together can sound like one of those internet gimmicks that promises the world and delivers nothing. So let me be very clear from the start. This is not magic. There's no miracle here. What there is logic, biology, and a method that starts to make sense once you understand what's really changing inside the male body over time. If you stay with me for a few minutes, I'll explain why this works, who it's for, and how to use it calmly and safely. My name is Dr. Lena. I'm a board-certified medical doctor, and for over 15 years, I've worked closely with men over 45. Men who are still strong, still capable, but who quietly notice that their bodies don't respond the way they used to. I see this every single day in real patients, not in textbooks. And I can tell you something honestly. Many of the most effective conversations about male aging never happen in the exam room. Not because doctors don't care, but because men often don't feel comfortable asking, and the system doesn't reward slow, preventative discussions. That's why topics like this, simple, supportive habits, are rarely discussed openly. Here's the truth that most men only sense but rarely hear explained. Starting in your 30s, and more noticeably in your 40s and 50s, your body begins to change its priorities. Testosterone gradually declines, yes, but that's only part of the picture. Blood vessels slowly lose some of their elasticity. Muscles in the pelvis and lower abdomen hold more tension without you realizing it. The prostate becomes more sensitive. Sleep becomes lighter, more fragmented. Nerves that once fired effortlessly become a little less responsive. None of this means something is wrong with you, and it is absolutely not in your head. It is biology doing what biology does when repair no longer keeps up with daily wear. One of the biggest misunderstandings I see is the idea that male performance and vitality are purely hormonal. They are not. Hormones matter, but they are only one piece of a much larger system. What truly determines how your body responds, day and night, comes down to three core factors. The first is blood flow, how easily blood moves through relaxed, responsive vessels. The second is muscle tone, especially in the pelvic region, where chronic tension can quietly block function. And the third is nerve signaling, which depends heavily on calmness, oxygen, and restorative sleep. The good news is this: all three of these factors remain modifiable well into later life. This is where the simple technique I want to share with you comes in. It's old, it's overlooked, and when you understand it, it's surprisingly logical. We're talking about a gentle, nighttime coffee and garlic preparation, not taken as a stimulant, not used for a sudden effect, but used as a slow, supportive ritual that works with your body during sleep. Nighttime matters because this is when your nervous system downshifts, inflammation settles, and tissues actually repair. What you do before bed often has more influence than what you do during the day. Garlic has been respected for centuries in traditional medicine for one primary reason: it supports circulation. Modern biology helps explain why. Compounds in garlic help the body produce nitric oxide, which signals blood vessels to relax. They also support healthy inflammatory balance. Coffee, when used in a very small, controlled amount and prepared properly, brings polyphenols that can improve local circulation and tissue responsiveness, without acting as a stimulant when applied externally or used in microdoses. Together, they form a warming, circulation-friendly combination that encourages relaxation rather than excitement. The method matters just as much as the ingredients. This is not about drinking strong coffee at night or overwhelming your system. The approach I recommend uses a small amount of freshly crushed garlic mixed into warm, diluted coffee to create a mild infusion. Some men choose to apply this externally as a warm compress to the lower abdomen or inner thigh area, where major blood vessels run close to the surface. Others prefer a very small oral preparation taken earlier in the evening, never close to bedtime, and always with food. The key is gentleness. The body responds best to calm signals, not force. If you're applying it externally, the process should feel almost meditative. You warm the mixture slightly, test it on your skin, and apply it comfortably, not hot, to the lower abdomen or groin-adjacent area while you sit or lie down. These regions matter because they influence pelvic circulation and nerve signaling. You breathe slowly. You let the warmth do the work. The entire routine takes less than 5 minutes, and there should never be burning, irritation, or discomfort. Nighttime is ideal because your parasympathetic nervous system, the part responsible for repair and recovery, is most active. Hormonal repair windows open during deep sleep. Blood vessels respond more readily to relaxation cues. I usually suggest using this routine 3 to 4 evenings per week, not every night. Consistency matters far more than intensity. This is about reminding your body how to restore itself, not pushing it. What do men notice over time? The first changes are subtle: a sense of warmth, a feeling of relaxation in the lower body, slightly deeper sleep, fewer nighttime awakenings. Over the following weeks, many men report improved morning responsiveness, better urinary comfort, and a quiet return of confidence. Not because something is being forced, but because normal function is being supported again. These are signals of restoration, not stimulation. There are also secondary benefits that don't get enough attention: reduced pelvic and lower back tension, improved urinary flow, fewer nighttime trips to the bathroom, a sense of groundedness in posture and mood. When the body feels supported, the mind follows. Now, let me be clear and responsible here. This approach supports overall male health. It does not replace medical care, and it is not a treatment for disease. Men with garlic allergies, sensitive skin, or digestive conditions should avoid or modify this. Anyone on blood-thinning medications should speak with their physician first. Hygiene matters. Pay attention to your body, and understand that meaningful change takes time, weeks, not days. The easiest way to make this work is to anchor it to something you already do, after brushing your teeth, while winding down with a book, as part of your nightly routine. Some men even involve a partner, not as a performance exercise, but as a shared moment of relaxation and care. When a habit becomes automatic, the body responds more consistently. I want to leave you with this perspective. Aging does not mean inevitable decline. It means your body now responds best to respect, rhythm, and support. Small habits, done calmly and consistently, create powerful long-term effects. I encourage you to think of this as a 30-day personal experiment. Observe how your body responds. Listen to it. Work with it. You are not broken. You are adopting. And with the right signals, your body remembers how to function with dignity, strength, and quiet confidence.